First of all, I would like to say that this event really marks the beginning of a new era in emergency and trauma care in the country and reiterates the commitment of state government to provide state-of-art health care to its citizens. As just Honorable CM has told us, emergency medical care is an important focus area of the Department of Health, Government of Kerala. Whatever may be the type of emergency, the aim of all the system is to give quality care in minimum time. Emergency care has multiple factors, including accessibility to facilities, availability of transportation facilities like ambulances, pre-hospitalization care, handling of patients at hospitals, and skilled and dedicated human resources. Kerala is and has been at the forefront of public health care in the country and is at par with even developed nations. We have set standards for others in handling disasters and pandemics. CM has mentioned about the low infant mortality rate, maternal mortality rate, and also the higher level of life expectancy. We have been lauded for the way we handled Nipah, COVID, and the floods that devastated the state a few years back, and the COVID challenge is not yet over. The Advanced Trauma Care and Emergency Learning Center ATELC, set up with the support of Tata Trust, is designed to fill the gaps, especially in training and skills in emergency and trauma care. The state has taken steps to strengthen emergency departments in healthcare institutions across the state. Medical colleges plays a pivotal role in emergency care, and many of the steps to strengthen the emergency clinical care at hospitals have already been initiated. We just had a discussion before this meeting, and we were discussing about the system we have adopted in the state, and during this year, in 22-23, we have developed an SOP for emergency medical care in the state. It includes some 50 components. We took more than 40 hours to develop that SOP, and that is, we took the pilot project, we implemented the pilot project in Thiruvananthapuram Medical College, and that is a model project, and we are planning to implement this in every other medical college. The government is taking steps towards setting up emergency care departments in all medical colleges. The trauma care system under the government has been restructured and strengthened based on the gap analysis undertaken by the state. And based on the study, state has taken steps to identify the following: identification of hotspots, strengthening of emergency response system and transport, including ambulance services, upgradation of infrastructure and equipment in the emergency department, capacity building and training of manpower, strengthening of manpower. CM has told already, we have identified more than 350 hotspots across the state, and basic life support ambulances are stationed in the hospitals along the state and national highways closer to the hospitals for effective emergency response and rescue operations. These hospitals were also strengthened and upgraded to deal with trauma and emergencies. These hospitals were also linked in a hub and spoke model with nearby medical colleges to ensure specialty care. It's also observed that the victims of trauma are stabilized and referred to appropriate higher centers which are within 30 kilometers radius of the first line centers. All casualty services were renamed as trauma and emergency care with the implementation of triage model in all the centers. Patients are categorized as red, yellow, and green based on the severity of the injury for stabilization and appropriate treatment and reference. And it's already mentioned here, Kerala has started emergency medicine departments at Kozhikode Medical College and Thiruvananthapuram Medical College. So this conclave, I think, is a step towards bringing world-class emergency departments in all medical colleges across Kerala. many institutions have first started the process of obtaining national accreditation and also international accreditations. Capacity building measures in terms of equipment, infrastructure, and manpower are being augmented as per the needs so that the quality of care is ensured. An independent committee, as mentioned by Honorable CM, has been created under the Department of Health to access the gaps and to suggest solutions for providing the optimal care. It was this committee who sat for more than 40 hours and we developed that standard operating procedure. In the emergency services, a triage system has been implemented in all medical colleges, and priority treatment based on the requirement is being provided through the division of treatments in different, like red, yellow, and green. So I would like to thank all the dignitaries who have admitted our invitation and who have come over from different parts of the world to join this conclave to make this a fruitful one. And the government wishes all the very best to this conclave and hopes that a document reflecting the deliberations here would be submitted for consideration.